Hello and welcome to Wellness Watch, a special show curated to ensure a healthy you and to acquaint you with a wide array of possible treatments and medical procedures India offers for various ailments. So let's embark on this medical journey. Wellness Watch with me each week. I am your host, Preeti. Neglected tropical diseases, or NTDs, are a group of 21 infectious diseases that primarily impact over 1 billion people living in poverty across the globe. NTDs are a diverse group of conditions that are mainly prevalent in tropical areas where they thrive among people living in impoverished communities. They are caused by a variety of pathogens including viruses, bacteria, parasites, fungi and toxins, and are responsible for devastating health, social and economic consequences. The World Health Organization recognizes 21 neglected tropical diseases, of which 11 are present in India. Today, we discuss the forgotten plagues, neglected tropical diseases. World Neglected Tropical Diseases Day, observed every January 30th, is a stark reminder of the global fight against some of the most devastating yet preventable diseases. The 2025 theme, Unite, Act, Eliminate, underscores the urgent need for action. Neglected tropical diseases, or the NTDs, don't just cause illness, they bring disability, stigma and economic hardship. But there is hope. With better sanitation, early diagnosis and timely treatment, most of these diseases can be defeated. Here's a report by DD India's Harshita Oberoi.
More than 1 billion people worldwide are suffering from diseases that are entirely preventable and treatable. These illnesses, known as neglected tropical diseases or NTDs, continue to devastate communities, trapping entire generations in a relentless cycle of poverty and ill health. NTDs are a group of 21 illnesses that primarily affect the world's poorest populations, particularly in tropical and subtropical regions. The reason they are called neglected is simple. They have long been overlooked on global health agendas, receiving little attention or funding. Caused by bacteria, viruses, parasitic worms, and toxins, these diseases thrive in conditions of poverty, lack of clean water, and inadequate healthcare. For decades, NTDs have been a silent crisis, trapping entire communities in a cycle of ill health and poverty. But now change is happening. The World Health Organization has set an ambitious goal to eliminate NTDs in 100 countries by 2030. The momentum is growing. 54 nations have already eliminated at least one NTD, and in 2024 alone, 7 more countries joined the fight. India, Vietnam and Nepal have eradicated trachoma, a leading cause of blindness. Bangladesh has eliminated Kala Azar, a deadly parasitic disease. And in a powerful declaration of commitment, India illuminated the iconic India Gate on World NTD Day. India carries one of the highest burdens of NTDs in the world, with at least 11 major neglected diseases including hookworm, dengue, lymphatic filariasis, leprosy, Kala Azar and rabies. The country has already conquered trachoma and guinea worm disease, but the battle is far from over. The next target, lymphatic filariasis, also known as elephantiasis. India has vowed to eliminate it by 2027, 3 years ahead of the global target. But even as victories are celebrated, new threats are emerging. Climate change is reshaping the landscape of diseases. Rising temperatures are expanding the reach of vector-borne illnesses like dengue and chikungunya, allowing them to spread into regions where they were once unknown. At the same time, health symptoms remain fragile, funding is inconsistent, and the COVID-19 pandemic disrupted vital treatment programs. So what must be done? Mass drug administration, mosquito control, access to clean water, better sanitation, education to fight stigma. These are the tools that can break the cycle of suffering.
The fight against neglected tropical diseases isn't just about medicine. It's about breaking the cycle of poverty and disease. communities must be empowered to recognize, prevent, and treat neglected tropical diseases before they take hold. Because in this battle, knowledge is power. And knowledge doesn't just inform, it saves life. Harshita Oberoi, reporting for Wellness Watch, DD India.
All right, it is estimated that NTDs affect more than 1 billion people, while the number of people requiring NTD intervention, both preventive and curative, is 1.5 billion. The epidemiology of NTDs is complex and often related to environmental conditions. Many of them are vector-borne, have animal reservoirs, and are associated with complex life cycles. All these factors make their public health control challenging. Despite at least one NTD affecting 149 different countries and territories, there remain major gaps in the technologies needed to address these diseases. India experiences the world's absolute burden of at least 11 NTDs, including hookworm, dengue, lymphatic filariasis, leprosy, Kala Azar, and rabies. Today, in Wellness Watch, we look forward to these specific questions. What are neglected tropical diseases? How are NTDs transmitted? Are these diseases life-threatening? Why elimination of NTDs is important? And what steps have been taken in India with regard to elimination of NTDs? All right, the basic idea of the show is to introduce you with medical options available in India and showcase India as a medical hub to the world. And up on your screens, we have hospitals and institutes which specifically treat NTDs, some of the hospitals, in fact, in the country. The National Center for Vector-Borne Diseases, Delhi, Government Medical College, Himachal Pradesh, Epidemic Diseases Hospital, Karnataka. To help us understand NTDs better, we are joined in by guests today. We're joined in by Dr. Atul Goel. He is Director General of Health Services, Ministry of Health and Family Welfare, Government of India. And virtually, Dr. Sunil Kumar Raina is joining us. He's Professor and Head, Community Medicine, Dr. RP Government Medical College, Himachal Pradesh. Thank you both of you for joining us on Wellness Watch this afternoon. Dr. Goel, we've told our viewers how massive is the threat of NTDs even in today's times. But to begin with, help our viewers understand what are neglected tropical diseases.
First and foremost, I would like to correct the term. The tropical diseases have been neglected by the world, but they are important diseases for a country like India, especially because the impoverished people suffer more from them. So for us, they are extremely important. Yes, there are a number of diverse diseases. 11 are currently being looked at from the point of view of elimination. However, there are a number of other neglected tropical diseases, or I would say important tropical diseases, and a number of steps are being taken. Although, as you mentioned in your introductory remarks, that they are complex, it's actually very complex to eliminate them. One more thing I would like to point out, you mentioned as the national, the NCVBDC. It's not an institute which treats tropical diseases.
Okay.
It's an institute which actually runs the programs for control of these diseases. So it actually plans all the actions that are taken in terms of public health.
Okay.
So they're not really treating them. However, all hospitals, all government institutions are equipped to treat these tropical diseases. So the treatment is available virtually everywhere.
All right, from here I'll bring in Dr. Raina. Dr. Raina, why have the NTDs been neglected? Because as Dr. Goel tells us that they are important, India is also facing the burden of 11 NTDs. Why have these tropical diseases been neglected so far?
I think you have answered it very well in your opening remarks itself. Neglected tropical diseases are neglected because they are seen to be more prevalent among the vulnerable, the impoverished, the poor, wherein we don't have good sanitation. So they are not the disease of the rich and the Western people who have technological advantage over them, over us, as far as the disease are concerned. So you find research is limited in these areas, drug development is limited in these areas, primarily because of the fact that they are found to be more prevalent in areas which are not a part of the Western world.
All right, Dr. Goel, are NTDs life-threatening?
They are not really life threatening, they don't really kill the patient, but all of them, some of them can actually. For example, if you talk of cysticercosis, that can actually lead to death, but most of them lead to morbidities.
Okay.
And those morbidities are sometimes very severe. For example, if you look at elephantiasis, it causes severe disability because it causes thickening of the legs and the person finds it difficult to even move. So it's more disability than neglect. Similarly, when you talk of leprosy, that's also causes a lot of disability. It may not be life threatening.
Okay. Dr. Raina, how are these diseases transmitted? Are these diseases communicable?
You see, there is an agent, and then there is a vector, and then there is a host. So agents are mostly, as you rightly pointed out in the opening remarks, we have the viruses, we have the bacteria, the parasites. There are certain toxins which are carried by vectors in the form of mosquitoes or flies, and then they transmit it to the humans. Now they are transmissible in the sense that if somebody is infected, he has a chance of giving it to somebody else because of the fact that the vector will carry it from him, somebody else. So they are largely carried by vectors. That's why I usually ask people not to use the term neglected for these diseases. Because most of these diseases are vector-borne, so we can restrict this to these diseases as being classified as vector-borne diseases only, and not as neglected tropical diseases, because that gives a very wrong impression of the disease itself.
Dr. Goel, why is elimination of NTDs important? Talking of the threat of these diseases.
Elimination of NTDs is important because unless they are taken care of, they cost the exchequer, they are a burden on the healthcare system. Plus it reduces, the productivity of a young population. For example, if people who are earning members for their families, if they suffer from these tropical diseases, their profession and other things are affected.
All right. I would also want you to explain to our viewers what are the early symptoms that one can, watch out for. When is it the time to see a health specialist with regard to this? Because, these diseases generally occur in the neglected, they have been neglected because they occur in the impoverished regions where people are not very much aware of, these diseases. What should be the approach?
I'll take up a couple of diseases. I wouldn't be able to address all. Yes. So let's start with lymphatic filariasis. Lymphatic filariasis is a difficult disease to diagnose initially because it presents like any other fever. But after that fever has subsided, and if the disease is not suspected and treated, it leads to consequences like, swelling of the lower limbs, what we understand as elephantiasis. It could lead to swelling of the scrotum in males. So those consequences are actually disfiguring and very uncomfortable for the patient. At the time of the fever detection, they are treatable, but after that, only limited treatment is available for elephantiasis. So it's best to treat at the time of fever. Unfortunately, most of the time it's not picked up because it's not suspected. We think of malaria, we think of dengue, we think of chikungunya, but it's hardly thought. That's why, novel mechanisms like mass drug administration every year are practiced for trying and breaking the cycle of filariasis. Okay. If I compare that to another so-called important tropical disease, it's rabies. Now, rabies is not something which affects only the impoverished. It affects virtually everybody. Yes. It could potentially affect virtually everybody because you are exposed to dog bites and now even monkeys menace in the cities. Yes. So here probably the one approach is vaccination. But then vaccination of humans alone is not probably the only approach to prevent rabies. And rabies is one thing which has to be only prevented because once the onset is there is absolutely no cure. It leads to death.
Okay.
So two of these diseases which come to mind immediately. One more disease that you mentioned is Kala Azar. Yes. Kala Azar, India has eliminated actually like trachoma. So the number of cases have decreased a lot. So now what we have is more of dermal leishmanoid, which is a consequence of Kala Azar infection. Among other diseases, actions are being taken. So if there is any specific disease you want me to address, you ask me.
All right, we'll talk about that. But at present, I'll bring in Dr. Raina. Dr. Raina, which are the areas in the world which are facing the burden of NTDs? Where are NTDs prominently found in the world in today's times?
if you look at the eastern part of the world, if you look at Indian subcontinent, the South Asia, the African subcontinent, you have all these places that are having these neglected tropical disease. But surprisingly, if you look at the way the world is evolving now, some of these diseases are being found in the West as well. You can take an
Yes.
example of dengue. Dengue is coming up in areas like as far as Spain. In US, we are finding a few cases here and there. But this is largely these diseases are largely limited to the Asian part, the African part of the country, of the world. So these are the areas where you usually found these diseases.
All right, have any entities been eradicated? Sir did talk of some of the success, did acquaint us with success here in India. But then when we talk of the entities world over, have any entities been eradicated, Dr. Raina?
It would be wrong to basically differentiate them into diseases that have been eradicated, because if you talk of eradication, you talk of continental removal of the disease as a whole. So if you look at continents, so for example, American continent, the Australian continent, these diseases are very limited in these areas. So you can say that these diseases have been eradicated from these areas. But if you look at the Indian continent, or if you look at the African continent, these diseases are present there. Eradication technically means you tear out the causative agent, the viruses, the bacteria, the parasites that cause the infection. Unfortunately, we have not been able to do it across the world at this point in time. And anybody who claims that the infection is largely limited to these areas is largely banking on the fact that these patients of these diseases are coming up to us largely from these areas only, and not from the world over as such.
All right, Dr. Goel, sir is talking about it's not that easy to eradicate, but how has been India's journey with regards to entities? The aim is to eradicate entities by 2030.
It's not to eradicate, it's to eliminate.
Eliminate.
There is a difference between eradication and elimination. When Dr. Raina talks about eradication, I think the only disease that the world has been able to eradicate is smallpox.
Okay.
The other, probably they are approaching for polio. Rest of the diseases have been eliminated. Even trachoma has been eliminated, Kala Azar has been eliminated, leprosy was eliminated. But that does not mean that the diseases will not be found. The diseases would still be found, and they will continue to trouble a smaller number of people. So need to understand the difference between eradication and elimination.
Help us understand India's journey when we talk of elimination of entities.
For example, I take about Kala Azar. It's taken quite some time. It's taken 10 long years. However, in December 2024, we could actually declare elimination of Kala Azar.
Okay.
It's not that Kala Azar will not be found, but the number of cases will be extremely small to be of significance. Similarly, trachoma elimination has been quite a journey. So we've presented the dossier to the WHO for it being recognized as an elimination. Next, we are looking at, yes, it's a difficult task, but we are looking at elimination of rabies by 2030. So that's going to be quite an arduous journey, because the reservoir for rabies in the form of canines and in the form of monkeys and even in felines, for example, cats, domestic cats, is definitely a threat.
Okay. Dr. Raina, now these diseases, is it only about sanitation? Is it only about hygiene? How can NTDs be prevented? Are they preventable?
I think, as I said, you initially when you started, you put it very well. When you said that these diseases are not just about treatment or individuals and the disease itself, they are a complex interplay of a large number of factors that go into making these diseases of significance. So you have to take care of poverty. You will have to take care of the sanitation levels of the areas. You have to take care of the amount of travel that we do on a daily basis. You have to take care of the climate change that is happening around us. So it has to be a multidisciplinary approach. I would say that, look, the things that have happened to us maybe in last 2 decades with regard to travel and with regard to the climate change has made taking care of these diseases all the more difficult, because of the fact that you will find them more round the year now, more across the globe now than they would at some point in time. They were restricted, limited to certain areas, but there's a chance that they will be found across everywhere. Dengue is a very good example. If you go back to India 30 years back in India, and you would find that there were pockets of dengue in India, but you have more widespread dengue across India now. Look at Kala Azar. Kala Azar was something which you always used to say, this is limited to Bihar, to adjoining parts of Bihar, to Assam. But we find cases of Kala-Azar even in Himachal Pradesh now, which is unexpected given the vector that causes that carries the disease itself. So more widespread now, more complex than it was at some point in time, and we have a very big social component attached to the disease of neglected tropical diseases than we think about regarding other diseases.
All right, Dr. Goel, to what extent has climate change played a role in the spread of NTDs?
You see, climate change to the extent that global warming is occurring, it would always make infectious disease more possible. Because these situations would favor development of infectious diseases, for that matter all diseases, not just these tropical diseases.
Yes.
Because all the organisms which cause diseases tend to thrive more in warmer and humid climate.
Dr. Raina, what are the research and development, or for that matter innovations that have been made with regards to elimination or efforts to eliminate NTDs in India?
I think India is doing well as far as neglected tropical disease is concerned in terms of research, because again it's an area of concern for us more than an area of concern for the Western world. While the West will largely focus on development of vaccines, we are also a part of that process of development of an appropriate vaccine for a few of these diseases. But I think the focus will be in identifying models which are able to pinpoint the areas wherein these diseases are more in number as compared to the areas wherein they are in less in number. And the research focus is also research is also being focused on seeing whether we are extending the area of this disease or not. There are models in place which identify whether the diseases which were restricted to one area, they are extended to other areas or not. So maybe whatever interventions that we have at this point in time in terms of treatment, in terms of diagnosis, that needs to be extended to the fact that we are able to reduce the number of the diseases after we have made an intervention. For example, if we give a drug intervention, we need to see whether this intervention is effective or not. We also need to have point of care diagnostic tests. We need to have easier tests which are able to be applied at the place wherein the disease is there and to be applied by people who are not very technically, who are not needed to be technically highly qualified to use them. So maybe point of care diagnostics, maybe seeing that we don't extend the area of the disease after intervention, finding better interventions, and of course vaccine will be one area wherein we need to be more focused as far as research is concerned.
All right, that was the approach put forward by Dr. Raina, but then Dr. Dr. Goel, where are we standing on the global page when we talk of elimination of NTDs? Because our aim is to eliminate entities in the country by 2030. Sir has also talked of research and development that is being made in the country. What is your evaluation of the efforts that have been made and the journey ahead?
You see, the very fact that we call them neglected, which means the West never did research on the diagnostic methods as well as the treatments that were available for these tropical diseases. So that practically has to be done by the country itself. And to that matter, ICMR is probably getting into the point of care tests that Dr. Raina was talking about. And if we have availability of these point of care tests, I don't think there should be a problem in diagnosing the diseases where they occur. Sometimes the tests may be too complex to be done at the level of the periphery. So you need to actually develop those point of care tests. And he also mentioned that they should not be technically very difficult to do, because in those areas you need easy tests. So I think we are doing pretty well and progressing. I don't know about 2030, although it's a very arduous task, but we are on course.
Yes. All right, so those were our guests explaining to us and helping us understand the NTDs today. But then very quickly we'll have a Mythbuster round, a rapid fire question round. Dr. Goel, are NTDs ancient diseases?
Yes, they are pretty ancient.
Dr. Raina, do neglected tropical diseases only affect the adults?
No, they may affect all the age groups.
Dr. Goel, are NTDs untreatable and always fatal?
No, they are all treatable. Couple of diseases could be fatal, most of them are not fatal.
And can NTDs spread through casual contact, Dr. Raina?
Not exactly casual contact, but they can spread from one person to another.
All right, so that sums up our discussion this afternoon. Thank you so much, both of you, for joining us on Wellness Watch and helping us understand neglected tropical diseases better. So those were our guests. telling us more about NTDs. But remember, combating NTDs not only reduces the burden of these diseases, but also contributes to stronger health systems. Addressing the impact of climate change on NTDs is possible through a One Health approach that combines human, animal and environmental health, and that empowering people and communities will lead to person-centered, tailored, inclusive programs and pave the way for sustainable and effective programmatic solutions to the challenges faced, eventually achieving the vision of an NTD-free world. On that note, we'll end this edition of Wellness Watch. Till we meet next, take good care of yourselves. Bye-bye.